wearing of red armbands to send the first alert in a series of intended actions before total withdrawal of services on Friday, June 9 by the Ghana Registered Nurses and Midwives Association is not strictly being adhered to in some health facilities visited in Accra. Hannah Odame is on grounds and joins us with more on what she observed. Hannah.
Nana?
Yes, Hannah.
So we started off at the Adabraka Clinic, Adabraka Hospital. Can you hear me, MFA? So we started off at the Adabraka Hospital, and there, when we got there, we saw some of the nurses in the red armbands, and then we saw some of the nurses who had the yarn, the fabric, lots of them. They were cutting it into pieces so they could distribute it to their other colleagues. And then we moved to the Accra Psychiatric Hospital, where we saw lots of the nurses there in the red armbands. For there, some of the nurses who spoke to us off camera said that they fully support the decision by their executives and they will comply to the latter. We all know today is just an alert they are sending. It's just the red armbands. Then on Wednesday, if government does not heed to their request or respond to them in any way, they will withdraw OPD services. Then on Friday, still, if they haven't heard anything from government, they will completely withdraw all services. So today's on is just an alert. It doesn't mean they will not be working. They are still working anyway, wherever we went. Currently, as you can see, I am at the Greater Accra Regional Hospital, and I haven't seen a lot of the nurses in red armbands there. We have been to some of the units. We went to the pediatric units, we went to the emergency, we went to the main OPD, we've been to some of the little dental, we've been to some of the units. We haven't seen a lot of them here at the Ridge Hospital. I think I've counted just about 2. We were here in the morning, we have come back here in the afternoon, and we don't have a lot of them in the red armbands. But what we have heard and we have been told is that they are complying silently, except we haven't seen them yet, even though we have seen some nurses. So that's the situation from the Adabraka, the psychiatric, and the Ridge Hospital, MFR.
We've seen some, we have not seen some. They are complying silently. But away from Accra, I'll take you to Kumasi. At the Komfanochi Teaching Hospital, compliance is in full effect as nurses and midwives are visibly donning red bands in protest of the delayance. First Deputy Chairman of the association in the Ashanti region, Philemon Adu Brempong, believes the ministry is deliberately dispelling the association to undermine their fight for better conditions of service.
Suspect any internal sabotage?
Sure, we are seeing that. You know, the labor law permits freedom of association, and we are having about 5 splinter groups. And the ministry is relying on these people. We don't know what has transpired between them, but from where I'm sitting, I can see that some people might have taken some bribe or taken money. That's why they are sabotaging us. Because what we are fighting for all nurses and midwives in this country. So if these unions are interested in the welfare of their members, why are not joining the strike? Because what we are fighting for is rural incentive allowance. Do they have their members in the rural areas? We are talking about 5% on-call facilitation. Are they having their members who will be on call? These are things that is very, very important. The uniform allowance, they are included in this. So why are they backtracking from the strike action? If they are not taking anything from them, are they in bed with the government? These are questions that we can pose, and they have to come out and answer. Why are they against the welfare of nurses and midwives in this country? It's something that I can't understand.
Now, let's discuss your strike. How effective do you think it can be if these unions are not part?
GRNMA, we have over 100,000 nurses and midwives across the country with all allies, including rotational nurses, including student nurses. So you can see my colleagues are behind me. He is a district executive from Upper West. They are here. We are all gingered up to ensure that this strike is a success.
Well, let's engage Clinton Yeboah, who will be joining us for more details. Clinton, tell me, is noon or beyond noon, what's it like in Kumasi?
Hello, Amefa.
Yes.
Currently at the Komfanochi Teaching Hospital, tensions are still up because the nurses are in in all of them are in compliance with the directives that were given by the National Executive. And what they say is that they are very much disappointed in the government for delaying, first of all, the terms that they are supposed to, agree to, and also for the numerous meetings that they have had with the government that there has been no resolution to them. They feel that the government is somehow infiltrating the association and dispelling their arms in order to have a smooth run over what they are demanding.
Well, Clinton, beyond the red bands, is it affecting anything at all at the hospitals? Are patients or customers walking in and out of the hospital without being served?
Well, at the oncology department of the Kumasi Teaching Hospital, nurses are working. Everybody is working. However, they working today is just a one step to the other. According to their own timeline, they are supposed to work today, just be in the armband. And then from there, from the 4th to 8th, then they would halt some of their services, including emergency services.
Right. Thank you, Clinton. Thank you so much for that. It looks like they're only throttling to the main thing. We'll bring you all the details from the Ashanti region, including as well here in Accra.